My father had various menial jobs while he was trying to learn the language, and worked in a dump for a while. They'd send him off to get a hammer. He'd come back with a wrench. They'd all laugh at him. But he learned English the way a lot of us have seen in the movies. He went to the movies and sat there and watched movies after movies to learn the language. He eventually had a job in a small factory in Traverse City that made clothing called True Fit Trousers, which was owned by a member of the Jewish congregation, which was how he got into that job. But he wasn't particularly comfortable with that job for a number of reasons. And at some point, an opportunity came, and he took the civil service exams, and he went to work for the state of Michigan as an attendant at the state hospital in Traverse City. And at that time, the state of Michigan had at least 4 big mental institutions. One in Traverse City, one in Brighton, one in Ionia, maybe one in Kalamazoo. So my father was hired on as an attendant, got an education equivalent to being a practical nurse. His working there at the hospital is a fascinating story. Most of the people that he worked with were not as educated or as sophisticated as he was. Most of his fellow workers, really looked upon their job as being a guard, which is essentially what they were, because there really wasn't any therapy going on at that time. So my father worked there for a number of years and worked his way and became accepted and then looked up to and a leader at his level. And at some point they came to him and asked him if he would take over and be the supervisor on this particular ward, which was the most violent, craziest ward in the hospital, where a lot of the people in the mental institutions at that time were not mentally ill in the sense of what we think of today, but were alcoholics or had low IQs, and the families didn't want them, and it was a good place to just warehouse people. There certainly were many people who were psychotic and needed to be hospitalized, but there were a lot who probably didn't. But anyway, my father was asked to take over the ward that had the most disturbed patients. And he said, well, I want to think about it. And he did think about it. And then he did something that it's hard to imagine today to think about this, but my father was an attendant. And as I said earlier, that's kind of like being a guard. Well, the guy that ran the hospital was a psychiatrist. He was a physician, so physicians aren't usually used to having the attendants telling them what should be done. The things go the other way. Well, my father went back to the superintendent of the hospital and said he would take it if they would allow him to make some changes on that ward as to how the patients were dealt with. And because my father had so much empathy with people, because of his experiences of being thrown into prison by the Nazis, he had a lot of empathy for people. So the superintendent said, well, what do you have in mind, Henry? My father said, we're going to do away with the strong room. The strong room was the padded cell. Those actually did exist in mental hospitals. Well, think about that. He said the patients are going to be issued utensils and they're going to eat with silverware and not with their hands anymore. And we'll count the stuff out and count it back in. Well, think about that. We're not going to be using a straitjacket anymore. And the superintendent ceded to my father's, lack of a better word, demands, and he took over that ward. and made many changes. And this, as I said, this was before there were psychoactive drugs and much treatment. And, psychotic people were really sick, and they were not treated well. But he treated them well. And my mother also worked at the hospital. And then she ended up working for a psychiatrist. And she translated papers for him that came to him in Italian and German and French because she spoke 5 languages. So they both ended up working in the mental hospital in Traverse City for the state of Michigan, which maybe in the late 40s and the 50s, it didn't look like the best career in the world, but when they became older and retired, it turned out to be a pretty good deal with the benefits that they'd accrued and the fact that they got Social Security and state pension and health care and so on.